Do you know someone with chronic kidney disease? Chances are you do, but they may not even know that they have kidney disease. And here's why. 9 in 10 U.S. adults with chronic kidney disease don't even know that they have this problem. Wow. And get this, 1 in 7 U.S. adults are diagnosed with chronic kidney disease. It affects 37 million Americans. I'm Dr. Hamilton Stubbs. I'm a double board certified sleep specialist. I'm trained in neurology. I'm a member of the American College of Lifestyle Medicine, and I'm a medical missionary. I love teaching people how to improve their health, and today I'm going to be talking about kidney disease and how it relates to sleep. Yep, you heard that. Getting adequate sleep is important for your kidney health. So let's just dive in now. And by the way, if you haven't already subscribed to my channel, I hope you will. I'd love to have you. And don't forget to hit notifications so you'll know when I upload my next video. If you know someone that could use this information, be sure to share this. This is information that could save their life, or at least slow down the rate of kidney disease. So in the U.S., you may not have been thinking about kidneys because unless you get diagnosed with kidney disease, we don't usually talk about the kidneys. They're like powerhouse organs in our abdomen that's running in the background of everything that we're doing. If you don't have good kidney function, you will definitely have an impairment of your quality of life and especially the duration of your life. Things like restless leg syndrome will become minor, but it happens to be a problem that happens early on when you start to lose your kidney function. So if you've never had a problem with your legs giving you these creepy crawly feelings when you're trying to go to sleep, or if you're sitting still and you're trying to watch a video like this one, then you may have restless leg syndrome. And believe it or not, it could be something that you did unknowingly, like taking over-the-counter pain pills. Those non-steroidal anti-inflammatory drugs are the #1 reason why I used to see people with new onset restless leg syndrome. So the kidneys are very important to us and our health. They help us by removing waste and extra water from our body to create what we call urine. And the urine is going to carry out waste products. It is going to remove from your body your metabolic waste, substances that could harm you, your medications. Some of them are being metabolized through the kidneys, so you need your kidneys to help with that. But it also helps control the balance of some important minerals, magnesium, potassium, and calcium, which are all very important for your cardiovascular system and your blood pressure. It helps to balance out your hormones, and the kidneys are important for converting vitamin D into the active form. If you start to lose your kidney function, it may show up as a mild anemia because the kidneys are important for stimulating the bone marrow to make red blood cells. The kidneys help us with our acid-base balance, something that a lot of people are very interested in because of so much emphasis on eating an alkaline diet. So the kidneys are very, very important to us. They're powerhouse organs running in the background where they're not really getting a whole lot of attention. So who's at risk for kidney disease, and who should be making sure that we're asking our doctor to evaluate us for our kidney health? Just about everybody who lives in the U.S., because 1 in 7 adults in the U.S. are at risk for developing kidney disease. And that's a lot of people. If you happen to be African American, Hispanic, or American Indian, the risk is even higher. And this is thought to be in part due to diet, our lifestyle, and they have a lot of problems in these communities with diabetes and hypertension and stress. So compared to white Americans, African Americans are 4 times more likely to develop kidney disease. African Americans make up just 13% of the U.S. population, but 35%, did I get that right, of the people diagnosed with kidney disease. And it's thought to be related to the high incidence of diabetes and hypertension among African Americans. So you're more likely to develop kidney disease if you have diabetes and high blood pressure, but also if you have cardiovascular disease or you have a family history of kidney failure. So today I want to give you 4 tips on how to lower your risk for kidney failure or disease and try to protect your kidneys. And here we go. We're going to start with nutrition. Nutrition is very important, and you know that. Eat more fruits, vegetables, and whole grains, and try to stay away from processed foods as much as possible. So if you don't know what processed foods are, if it comes in a box, consider it processed. See, when we get these foods in boxes, manufacturers have put things in to make it taste good or to extend the shelf life, and some of these things are chemicals that are harmful to our bodies. So if you can, try to stay away from processed foods that's coming in a box. And if you use tobacco, you want to try to just stop that. I know it's very difficult, although some people have been able to just cold turkey and get off tobacco. But if you have difficulty and you live in the U.S., you can actually go to smokefree.gov. It's a website by the federal government that's going to give you some tools and some resources that may be helpful in your overcoming the tobacco addiction. And you can also talk with your healthcare provider. There are some medications that might help you a little bit with controlling the tobacco cravings. Limit your alcohol consumption. Now, for this, I'm going to say use the National Kidney Foundation guidelines, because how much alcohol is considered too much alcohol may have something to do with your environment. For example, if you live in a community where people drink lots and lots of, usually it's beer, you may be drinking more beer than most people, even though in that community you're not drinking that much. So if we look at what the experts who give information to the National Kidney Foundation recommend, this is what they're saying. They describe one drink as one 12-ounce serving of beer, 1 glass of wine, or 1 ounce or 1 shot of hard liquor. So use that as your reference point to see if you are having too much alcohol. The alcohol is toxic and it will damage your kidneys over time. And here's where I come in. Make sure you're getting adequate rest. And it's so much easier to sleep when you sleep according to your predetermined genetic bedtime. I'm going to put the link below so that you can find that quiz, take it, and then join me for a free webinar where I'm going to teach you what is your predetermined bed type and how to optimize your sleep around that, because we're all unique and what's good for me may be a little different from what's good for you. It's thought that when you don't get adequate sleep, then it's the inflammation that's associated with sleep deprivation, as well as that overstimulation of the sympathetic nervous system, that could be damaging those very small blood vessels found in your kidneys and in that filtering system. So we want to try to not just go to bed, but do some things to optimize the quality of our sleep. And if you have undiagnosed sleep disorders, get those diagnosed so you can get proper treatment. The last thing I want to suggest is if you take over-the-counter medications, herbs, supplements, or if you have prescription medications, you may want to talk with your pharmacist to find out if any of these could be damaging to your kidneys, and then take that information to the prescribing healthcare provider and see if there's a way that that medication can be changed, lowered, or some way to protect your kidneys. Even if you have to take the medicine, it might mean that you need to have your kidney health monitored more regularly than other people. If you already have diabetes, hypertension, or heart disease, you can still work with your healthcare provider to try to stabilize these conditions, and you can work with someone from the American College of Lifestyle Medicine, someone like me, take some of my classes where I'm helping people learn how to reverse high blood pressure. And we're going to be adding how you can lower your hemoglobin A1C by eating the low added sugar way, one of my first programs. So if this has been helpful, I hope you give me a thumbs up. Don't forget to share this information with someone else that you think could use it. If you haven't subscribed, what are you waiting for? Hit that subscribe button and don't forget to turn on notifications. I try to do these videos once a week, but sometimes I get behind. You can also check out my blog at drhamiltonstubbs.com. See you next time, and don't forget, be a blessing to someone else.